Acid reflux. It's the most common chronic gastrointestinal disorder Americans face. According to the National Institutes of Health, about 20% of adults in the U.S. have dealt with acid reflux.
And for those who suffer, often the pain and discomfort can disrupt quality of life, but left untreated, acid reflux can actually lead to more serious conditions. Dr. Latasha Henry, a gastroenterologist with USA Health Providence, joins us now to discuss ways to find relief. Doctor, thanks for joining us. What's the first line of treatment for acid reflux?
Well, thank you for having me. The first lines of treatment include a lot of lifestyle changes, specifically our diet, risk factors that we can manage, including stopping smoking or drinking alcohol, exercise routinely, and obesity is a very high risk factor for gastroesophageal reflux disease. And so weight loss is a big part of that management and exercise.
Doctor, there are so many things you can get over the counter for relief, but at what point should someone seek medical treatment for acid reflux?
Typically, if your symptoms persist more than a couple of weeks, you should seek treatment. If those over-the-counter medications aren't working for you, and truly when this interrupts your daily life, if you're having trouble sleeping, nighttime symptoms are often a reason to seek treatment.
Oh, doctor, what are some of the surgical options? If over-the-counter things aren't working, what kind of surgery could you have to treat acid reflux?
Well, there are some non-surgical options, including surgical options, but typically we would diagnose that and look further into this with an endoscopy exam or a barium esophagram. Some of those tests are invasive. Surgical options include some of those that treat some of the risk factors, including obesity. So some of our bariatric surgeries, such as a gastric bypass or a gastric sleeve, we do try to avoid that, but if we get to that point, we certainly have those options available. A fundoplication is also something that we use to treat GERD, and that just reinforces the lower esophageal sphincter to help prevent any of that reflux of the acid into your esophagus.
And doctor, left untreated, acid reflux can cause some serious problems.
True, it can cause strictures in the esophagus, which causes problems with swallowing. It can be a precursor or lead to Barrett's esophagus, which is a precancerous disease. So we do take reflux disease very seriously.
Yes, Dr. Latasha Henry with USA Health. Thanks so much for joining us tonight.
All right, thank you for having me.